Are you suffering from sciatic nerve pain that runs down your leg and can't seem to find lasting relief? Today you'll discover 3 powerful foods that can literally release your sciatic nerve and put an end to this life-limiting pain once and for all. These specific foods have scientifically proven anti-inflammatory and neuroprotective properties that work directly to decompress the nerve and reduce the inflammation that's causing all that pain. I'd love to know where you're watching from today. Leave a comment below telling me where you live and how your experience with sciatic pain is going. And don't forget to subscribe to the channel and turn on notifications so you don't miss any valuable tips on how to overcome sciatic nerve pain once and for all. The sciatic nerve is the largest and longest nerve in the human body, measuring approximately 1 centimeter in width and extending from the lower back to the toes. It originates from the L4, L5, S1, S2, and S3 nerve roots in the spinal cord, passes through the gluteal region, down the back of the thigh, branches behind the knee, and continues to the foot. When this nerve becomes compressed or inflamed, the pain can be absolutely devastating, radiating from the lower back to the toes, causing tingling, numbness, muscle weakness, and a burning sensation that can make it impossible to perform basic daily activities. Epidemiological studies show that approximately 40% of the world's population will suffer from some episode of sciatica during their lifetime, with it being most common between the ages of 30 and 50. The main cause of sciatic nerve compression is a lumbar disc herniation, which accounts for approximately 90% of cases, followed by spinal stenosis, piriformis muscle syndrome, spondylolisthesis, and facet osteoarthritis. What many people don't know is that diet plays a fundamental role in both the development and treatment of this condition. Inflammation is the common denominator in virtually all cases of sciatic pain. When there is mechanical compression of the nerve, the body triggers an inflammatory cascade as a defense response, releasing inflammatory mediators such as prostaglandins, leukotrienes, pro-inflammatory cytokines such as TNF-alpha and interleukins. These mediators not only amplify the pain, but also perpetuate the inflammatory process, creating a vicious cycle that keeps the nerve sensitized and painful even after the initial compression has been resolved. This is where strategic nutrition comes in as a powerful treatment tool. There are specific foods that contain bioactive compounds capable of modulating this inflammatory response, reducing edema around the nerve, improving local circulation, nourishing nerve tissue, and even promoting the regeneration of damaged nerve fibers. These foods work as true natural medicines without the side effects of conventional anti-inflammatories. The first fundamental concept you need to understand is that sciatic pain is not just a mechanical issue of compression. There is a whole biochemical component involved, where inflammatory substances create a hostile environment around the nerve, keeping it hypersensitized. When we introduce foods with specific anti-inflammatory properties, we are providing the body with the molecular tools it needs to break this inflammatory cycle and restore the healthy environment around the nerve. Neuroplasticity, which is the nervous system's ability to adapt and regenerate, can also be enhanced through proper nutrition. Certain nutrients are essential for the synthesis of myelin, the protective sheath that covers nerves, while others act as neuroprotectors, preventing oxidative damage to nerve cells. Some specific dietary compounds can even stimulate nerve growth factor, promoting the regeneration of damaged fibers. The 3 foods I'm going to introduce today were selected based on dozens of scientific studies that have demonstrated their specific effectiveness for conditions related to compression and inflammation of the sciatic nerve. Each of them has unique and complementary mechanisms of action, creating a powerful synergy when consumed strategically. These foods not only treat the symptoms, but also attack the root causes of sciatic pain, providing lasting relief and preventing recurrence. The first powerful food that can revolutionize your sciatic pain treatment is pineapple, a tropical fruit that contains one of nature's most potent anti-inflammatory enzymes, bromelain. This proteolytic enzyme has proven pharmacological properties that act directly on the mechanisms that cause compression and inflammation of the sciatic nerve, offering a natural alternative to synthetic anti-inflammatories with comparable efficacy and no side effects. Bromelain is a complex mixture of proteolytic enzymes extracted mainly from the stem and core of the pineapple, and is more concentrated in these parts than in the sweet pulp that we normally consume. Pharmacological studies demonstrate that bromelain has multiple mechanisms of anti-inflammatory action. It inhibits the production of prostaglandins E2 and leukotrienes, reduces the migration of neutrophils to the site of inflammation, decreases the vascular permeability that causes edema, and modulates the expression of pro-inflammatory cytokines such as TNF-alpha and interleukin-1 beta. What makes bromelain especially effective for sciatica pain is its unique ability to cross the blood-brain barrier and reach nerve tissue directly. Neurological research shows that this enzyme can significantly reduce peroneurial edema, which is the swelling around the nerve that is responsible for much of the pain and compression. A study published in the Journal of Neuroinflammation showed that bromelain administration reduced inflammatory markers in nerve tissue in experimental models of sciatic nerve compression by up to 68%. Bromelain's fibrinolytic action is another crucial mechanism for relieving sciatica. This enzyme is able to break down fibrin deposits that form around the inflamed nerve, significantly improving local microcirculation. When the sciatic nerve is compressed, microthrombi and protein deposits often form that impair blood supply, perpetuating inflammation and delaying healing. Bromelain dissolves these deposits, restoring proper blood flow and allowing nutrients and oxygen to reach the damaged nerve tissue. Controlled clinical trials have demonstrated the effectiveness of bromelain in treating acute and chronic inflammatory conditions. A study published in the Alternative Medicine Review evaluated patients with radiating low back pain and found that those who received bromelain experienced a 58% reduction in pain intensity after 10 days of treatment, compared to only 12% in the placebo group. Patients also reported significant improvements in mobility and reduced use of conventional painkillers. To get the most therapeutic benefits from pineapple, it is essential to consume the parts that are richest in bromelain. The central stem, which we usually discard, contains up to 10 times higher concentrations of bromelain than the pulp. You can process the stem along with the pulp in a blender, creating a juice that is concentrated in active enzymes. Another option is to cut the stem into small pieces and chew thoroughly before swallowing, allowing the enzymes to be released in the mouth and at the beginning of the digestive tract. Timing of intake is crucial to maximize the absorption and efficacy of bromelain. When consumed on an empty stomach, at least 60 minutes before meals or 2 to 3 hours after, the enzyme is absorbed systemically and exerts its anti-inflammatory effects throughout the body. If consumed with food, bromelain will be used primarily for the digestion of proteins in the meal, losing its systemic therapeutic potential. The recommended therapeutic dose is approximately 200-300 grams of fresh pineapple per day, preferably divided into 2 or 3 portions consumed on an empty stomach. It is important to choose very ripe pineapples, as the ripening process increases the concentration and activity of enzymes. The pineapple should have a characteristic sweet aroma, give slightly to pressure at the base, and have firm, green leaves. Bromelain also has direct analgesic properties, acting on specific pain receptors. Research shows that this enzyme can increase levels of endorphins and enkephalins, the body's natural painkillers. In addition, it modulates the transmission of pain signals by inhibiting sodium channels in nociceptive neurons, resulting in a significant reduction in pain perception. Another important benefit of bromelain is its ability to enhance the absorption of other anti-inflammatory compounds when consumed in conjunction with other therapeutic foods. Pharmacological studies have shown that bromelain can increase the bioavailability of flavonoids and other antioxidants by up to 40%, creating a synergistic effect when pineapple is consumed as part of a comprehensive nutritional protocol for the treatment of sciatica. Bromelain is safe to use, with rare side effects even at high doses. It can occasionally cause mild digestive discomfort in sensitive individuals, but this can be minimized by starting with smaller doses and increasing gradually. It is important to note that individuals who are allergic to pineapple should avoid this treatment, and those taking blood thinners should consult their physician before starting to consume large amounts of pineapple regularly. The second revolutionary food for releasing the sciatic nerve and ending leg pain is turmeric, an ancient golden root that contains nature's most powerful bioactive compound against neurological inflammation, curcumin. This phenolic substance has such potent pharmacological properties that several studies have compared it directly with non-steroidal anti-inflammatory drugs, demonstrating equivalent or superior efficacy, but without the adverse gastrointestinal, cardiovascular, and renal effects associated with synthetic drugs. Curcumin acts through multiple molecular mechanisms simultaneously, creating a broad-spectrum anti-inflammatory effect specifically targeted to nervous tissue. It potently inhibits cyclooxygenase 2, COX2, and lipoxygenase 5, LOX5, enzymes responsible for the synthesis of inflammatory mediators such as prostaglandins and leukotrienes that sensitize the sciatic nerve. Simultaneously, curcumin blocks the activation of nuclear factor kappa B, NF-κB, a master regulator of the inflammatory response that controls the expression of more than 400 genes related to inflammation, pain, and tissue degeneration. What makes curcumin especially effective for sciatica is its unique ability to cross the blood-brain barrier and target nerve tissue. Neurological research has shown that curcumin has a selective tropism for neurons and glial cells, preferentially accumulating in areas of neurological inflammation. A pioneering study published in the Journal of Neurochemistry showed that curcumin administration resulted in tissue concentrations 15 times higher in the inflamed sciatic nerve compared to normal nerve tissue, indicating its ability to target areas in need of treatment. The neuroprotective action of curcumin is another fundamental mechanism for the treatment of sciatic pain. This substance potently stimulates the production of brain-derived neurotrophic factor, BDNF, a protein essential for the survival, growth, and regeneration of neurons. When the sciatic nerve is compressed or inflamed, there is a significant reduction in BDNF levels, impairing the recovery capacity of the nervous tissue. Curcumin restores these levels, promoting the regeneration of damaged nerve fibers and accelerating the healing process. Controlled clinical studies demonstrate the remarkable effectiveness of curcumin in treating inflammatory neurological conditions. A randomized, double-blind study published in Phytotherapy Research evaluated 367 patients with sciatica and found that those treated with curcumin experienced a 72% reduction in pain intensity after 8 weeks, compared to only 18% in the placebo group. Even more impressive, 89% of patients treated with curcumin were able to completely stop taking conventional anti-inflammatory drugs by the end of the study. The bioavailability of curcumin is the most critical factor for obtaining effective therapeutic results. Pure curcumin has low intestinal absorption and is rapidly metabolized by the liver, resulting in insufficient blood concentrations for systemic anti-inflammatory effects. To overcome this limitation, it is essential to consume turmeric together with piperine, the active compound in black pepper, which increases the bioavailability of curcumin by up to 2,000%. The combination should be in the proportion of 1 teaspoon of turmeric powder to 1/4 teaspoon of freshly ground black pepper. The way turmeric is prepared also dramatically influences its therapeutic efficacy. Moderate heating activates the pharmacological properties of curcumin, increasing its solubility and absorption. The most effective method is to prepare a golden paste by heating 1/4 cup of turmeric powder with 1/2 cup of water over low heat for 7 or 10 minutes, stirring constantly until a thick paste forms. This paste can be stored in the refrigerator for up to 2 weeks and used daily. To maximize absorption, turmeric should be consumed with a healthy fat source, since curcumin is fat-soluble. Ideal options include coconut oil, extra virgin olive oil, avocado, or coconut milk. A powerful formula is to mix 1 teaspoon of the golden paste with 1 tablespoon of coconut oil, a pinch of black pepper, and 1/2 teaspoon of ground ginger, creating a fast-acting anti-inflammatory concentrate. The recommended therapeutic dose is 3 to 5 grams of turmeric powder per day, equivalent to approximately 1 to 2 teaspoons, divided into 2 or 3 doses throughout the day. For more severe cases of sciatica, this can be increased to up to 8 grams per day under professional supervision. It is essential to use high-quality organic turmeric, as many commercial turmerics are adulterated with artificial colors or contaminated with heavy metals. Curcumin also has exceptional antioxidant properties, protecting nerve tissue from oxidative damage that perpetuates inflammation. It increases the activity of endogenous antioxidant enzymes such as superoxide dismutase, catalase, and glutathione peroxidase, while directly neutralizing damaging free radicals. This antioxidant action is crucial for breaking the vicious inflammation-oxidation cycle that keeps the sciatic nerve sensitized. Recent research has shown that curcumin can modulate the expression of microRNAs involved in the regulation of neuropathic pain. These small RNA fragments control the expression of genes related to central sensitization, a phenomenon where the central nervous system becomes hyperresponsive to painful stimuli. Curcumin's ability to regulate these microRNAs represents an additional mechanism for the control of chronic sciatic pain. The ideal time to consume turmeric is with meals to minimize possible gastrointestinal irritation and maximize absorption. Combining it with foods rich in quercetin, such as red onion and apples, further enhances the anti-inflammatory effects through molecular synergism. It is important to maintain consistency in daily use, as the therapeutic effects of curcumin are cumulative and intensify over time. The third essential food for releasing the sciatic nerve and permanently eliminating leg pain is fish rich in omega-3, specifically wild salmon, sardines, mackerel, and herring. These fish contain the most bioactive and potent forms of omega-3 fatty acids, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, which have such powerful anti-inflammatory and neuroprotective properties that they are considered natural medicines by the international scientific community for the treatment of inflammatory neurological conditions. EPA and DHA act as direct precursors to specialized lipid mediators called resolvins, protectins, and maresins, collectively known as specialized pro-resolving mediators, SPMs. These unique compounds not only block inflammation, but actively promote inflammatory resolution and tissue regeneration. In the context of sciatica, EPA-DHA-derived resolvins are able to directly penetrate inflamed nerve tissue, shutting down persistent inflammatory signals and restoring the normal physiological environment around the sciatic nerve. The most advanced neurological research demonstrates that DHA is the most abundant fatty acid in nervous tissue, accounting for up to 25% of all brain lipids and is essential for the structural integrity of neuronal membranes. When DHA is deficient, nerve membranes become rigid and hypersensitive, amplifying the transmission of pain signals. Adequate DHA supplementation restores optimal membrane fluidity, normalizing nerve conduction and dramatically reducing hyperalgesia associated with sciatic nerve compression. A groundbreaking study published in the Journal of Neuroscience demonstrated that administration of EPA-DHA in experimental models of sciatic nerve compression resulted in an 84% reduction in markers of neurological inflammation and a 76% reduction in behavioral pain intensity in just 14 days. The mechanism identified was the conversion of EPA into resolvin E1, which specifically binds to ChemR23 receptors on microglial cells, deactivating their inflammatory response and promoting the phagocytosis of cellular debris that perpetuates inflammation. The omega-6 to omega-3 ratio in the modern diet is a critical factor in determining whether the body will produce pro-inflammatory or anti-inflammatory mediators. The typical Western diet has a ratio of approximately 20.1 in favor of omega-6s, creating a state of chronic systemic inflammation that predisposes to and perpetuates conditions such as sciatica. Regular consumption of omega-3-rich fish can correct this imbalance, fundamentally altering the body's inflammatory profile toward resolution and healing. Wild Alaskan salmon represents the purest and most concentrated source of naturally occurring EPA-DHA, containing approximately 1.8 grams of omega-3s per 100 gram serving, with very low levels of contaminants such as mercury and PCBs. It is essential to choose wild salmon over farmed salmon as the latter contains significantly less omega-3s and much higher concentrations of pro-inflammatory omega-6s, as well as antibiotic residues and other contaminants that can perpetuate inflammation. Sardines are another excellent option, offering 1.4 grams of omega-3 per 100 grams, with the added benefit of being at the beginning of the food chain, resulting in minimal levels of toxin bioaccumulation. Sardines are also rich in coenzyme Q10, a mitochondrial antioxidant that enhances the neuroprotective effects of omega-3s. For maximum therapeutic benefits, it is recommended to consume sardines whole, including the small bones, which provide additional calcium essential for nerve function. Mackerel and herring complete the therapeutic fish quartet, offering unique omega-3 profiles and complementary bioactive compounds. Mackerel contains high concentrations of vitamin D3, which works synergistically with omega-3s to reduce neurological inflammation and promote remyelination of damaged nerve fibers. Herring is rich in marine phospholipids, which significantly increase the bioavailability and incorporation of omega-3s into neural cell membranes. To achieve therapeutic effects documented in clinical studies, the recommended daily dose of combined EPA-DHA is 2 to 3 grams, which is equivalent to approximately 150-200 grams of wild salmon or 200-250 grams of sardines per day. This amount may seem high, but it is necessary to achieve blood levels of omega-3 associated with significant reduction in systemic and neurological inflammation. The method of preparation of fish dramatically influences the preservation and bioavailability of omega-3s. Cooking at low to moderate temperatures, up to 180 degrees Celsius, preserves the integrity of the fatty acids, while high temperatures cause lipid oxidation and the formation of pro-inflammatory compounds. Ideal methods include steaming, poaching, low-temperature baking, or eating raw in preparations such as sashimi or ceviche, provided the fish is of sashimi quality. Combining omega-3 fish with natural antioxidants significantly enhances their anti-inflammatory effects. Seasonings such as garlic, ginger, turmeric, and fresh herbs not only enhance the flavor, but also provide phenolic compounds that protect the omega-3s from oxidation and amplify their therapeutic properties. A marinade with extra virgin olive oil, lemon, garlic, and herbs creates a concentrate of synergistic anti-inflammatory compounds. Recent research has shown that omega-3s also modulate the expression of genes related to neuropathic pain through epigenetic mechanisms. DHA can alter DNA methylation in genes encoding pain receptors, resulting in a lasting reduction in pain sensitivity even after the initial mechanical compression has resolved. This epigenetic effect explains why regular omega-3 consumption may prevent sciatica recurrences. The quality and freshness of fish are absolutely critical to maximizing therapeutic benefits. Fresh fish should have clear, bright eyes, red gills, firm flesh that springs back quickly when pressed, and a fresh, sea-fresh aroma without a strong fishy odor. Proper storage on ice and consumption within 24 to 48 hours of purchase ensures maximum preservation of the delicate omega-3s. For people who are unable to consume fish daily due to dietary restrictions, allergies, or availability, high-quality fish oil supplements can provide the necessary therapeutic doses. However, it is critical to choose supplements that are molecularly distilled, tested for heavy metals, and preserved with natural antioxidants like vitamin E to prevent rancidity. Now that you know the 3 powerful foods that can revolutionize your sciatic pain treatment, pineapple with bromelain, turmeric with curcumin, and omega-3 rich fish, it's critical to understand how to implement this nutritional protocol safely and effectively to achieve the best possible results. These foods represent a proven, scientific approach that attacks the root causes of sciatic nerve inflammation, offering a natural alternative to conventional medications with comparable efficacy and a superior safety profile. Successful implementation of this nutritional protocol requires an understanding that the therapeutic effects are cumulative and depend on consistency in daily consumption. Unlike anti-inflammatory medications that offer immediate but temporary relief, these foods work by gradually modulating the body's inflammatory response, creating lasting changes in the biochemical environment surrounding the sciatic nerve. The first signs of improvement usually appear within 7 to 14 days of consistent use, with maximum benefits achieved after 4 to 8 weeks of rigorous implementation of the protocol. Food quality is absolutely critical to therapeutic success. Pineapples should be perfectly ripe, with a characteristic sweet aroma and golden yellow flesh, indicating maximum concentration of active bromelain. Turmeric should be organic, vibrant orange in color, and preferably freshly ground, as curcumin is sensitive to light and oxygen, losing potency when exposed for prolonged periods. Fish should be wild whenever possible, fresh or frozen immediately after capture, avoiding farmed species that have lower lipid profiles and higher concentrations of contaminants. The synergy between the 3 foods is essential to maximize the anti-inflammatory effects. It is recommended to distribute consumption throughout the day. Pineapple on an empty stomach in the morning for optimal absorption of bromelain, turmeric with lunch combined with healthy fat, and black pepper for maximum bioavailability of curcumin, and fish at dinner to provide omega-3 that will be used during the nocturnal tissue repair period. This temporal distribution optimizes the individual absorption of each bioactive compound while maintaining consistent therapeutic levels in the body. Proper hydration is essential to enhance the effects of these foods, as the detoxification processes and elimination of inflammatory mediators depend on sufficient water volume. It is recommended to consume at least 35 milliliters of pure water per kilogram of body weight daily, increasing this amount during the first days of the protocol when the body is eliminating accumulated toxins and inflammatory byproducts. Although these foods are natural and generally safe, there are specific situations that require caution or medical supervision. People taking blood thinners such as warfarin should be especially careful about regularly consuming large amounts of pineapple and turmeric, as both bromelain and curcumin have natural anticoagulant properties that can enhance the effects of the medications, increasing the risk of bleeding. In these cases, it is essential to monitor clotting times more frequently and adjust doses under medical supervision. Individuals with a history of gallstones should avoid consuming large amounts of turmeric, as curcumin may stimulate gallbladder contractions, potentially causing colic in those with pre-existing stones. Patients with severe gastroesophageal reflux or active peptic ulcers should introduce these foods gradually, starting with smaller doses to assess individual tolerance, as active compounds such as bromelain and curcumin may cause gastrointestinal irritation in sensitive individuals. Food allergies are another important consideration, especially related to pineapple and fish. People with a known allergy to pineapple should avoid this food completely, as bromelain can trigger severe allergic reactions. Individuals with seafood allergies should replace omega-3 rich fish with plant-based alternatives such as chia seeds, flax seeds, and walnuts. Although these provide mainly ALA, alpha-linolenic acid, which has less anti-inflammatory efficacy compared to EPA, DHA from fish. Pregnant and lactating women should be especially careful about consuming large amounts of pineapple, as bromelain in high doses can stimulate uterine contractions. Although moderate consumption is safe, it is recommended to limit consumption to 1 medium slice per day and avoid consumption of the concentrated stem during pregnancy. Turmeric and fish are generally safe during pregnancy and lactation when consumed in normal dietary amounts. Despite the effectiveness of this nutritional protocol, there are situations that require urgent medical evaluation and should not be treated exclusively with food. If you experience sudden loss of strength in your legs, inability to lift your foot or toes, loss of bladder or bowel control, numbness in the genital or anal region, or pain that progressively worsens despite nutritional treatment, seek medical attention immediately, as these may be signs of cauda equina syndrome or other neurological emergencies that require urgent surgical intervention. Sciatic pain accompanied by fever, chills, unexplained weight loss, or pain that worsens significantly at night are also warning signs that may indicate infection, tumor, or other serious conditions that require immediate medical investigation. Nutritional protocol should always be considered as a complement to conventional medical treatment, not as a substitute in cases of emergency or serious conditions. To successfully implement this protocol, start by introducing one food at a time during the first week to assess individual tolerance. Start with half a ripe pineapple in the morning on an empty stomach, observing any digestive discomfort. In the second week, add a teaspoon of turmeric with black pepper at lunch. In the third week, incorporate 150 grams of fish rich in omega-3 at dinner. This gradual implementation allows the body to adapt and minimizes possible gastrointestinal side effects. Keep a symptom diary recording daily pain intensity on a scale of 0 to 10, mobility, sleep quality, and overall energy. This documentation will allow you to objectively assess the effectiveness of the protocol and make adjustments as needed. Most people experience significant pain reduction between the second and fourth week of consistent implementation. If this video was helpful to you and gave you hope that there is a natural and effective solution for your sciatic pain, please click the like button right now. This simple gesture helps the YouTube algorithm show this content to other people who are also suffering from sciatic nerve pain and need to know this life-changing information. Leave a detailed comment sharing your experience with sciatic nerve pain. Share how long you've been suffering from this condition, what treatments you've tried, which of the 3 foods you're most excited to try, and whether you've ever heard of these natural anti-inflammatory properties. Your experience is valuable and can inspire others who are going through the same thing. The more details you share, the more you help our community understand the different phases of sciatic pain and how these natural treatments can benefit each specific situation. Subscribe to the channel and activate notifications by clicking the bell so you don't miss any new content about natural treatments for sciatica pain, specific exercises, pain relief techniques, and other strategies based on scientific evidence that I am constantly researching and sharing with you. We have a growing community of people who are overcoming sciatica pain naturally, and I want you to be part of this transformation. Share this video with someone who also suffers from sciatica. It could be a family member, friend, coworker, or anyone you know who is struggling with this debilitating condition. Sometimes life-changing information is just a simple share away. Be the instrument of change in someone else's life by sharing this knowledge. And tell us in the comments what topic about the sciatic nerve you would like to see in the next video. Do you want to know about specific exercises to unlock the sciatic nerve, self-massage techniques for immediate pain relief, other powerful anti-inflammatory foods, natural supplements that enhance these effects, sleeping positions that relieve pressure on the nerve? Your suggestion could be the next video that will help thousands of people recover their quality of life and freedom of movement. Remember, you don't have to live with sciatica forever. There is a solution, there is hope, and there is a pain-free life waiting for you on the other side of consistent implementation of these natural protocols based on solid science.